All right, welcome back to our program and thank you very much for staying with us. Is slowing down the infection rate of the second wave of COVID-19 possible? Following President Ramaposa's address to the nation on the 14th of December, the onus lies with all South Africans, including corporate SAE, to take responsibility in fighting the virus. The president said the rise in infections in the past few weeks is the result of people not following basic precautions, including failing to wear face masks, practicing social distancing, washing their hands, and sanitizing. He called on all South Africans to comply with all safety regulations. So what practical solutions can be put in place to turn the tide on the pandemic? Let's ask Annette Devenish, who is Marketing Director at Sanitouch. And welcome to our program, Annette.
Thank you for having me.
Well, it seems like a day would never pass without anybody touching a sanitizer. So the question would be, firstly, is it important for one to scrutinize which sanitizer and the alcohol content in it when you go about your business, leaving home, entering one shop after the other, the malls and all that? Does it really matter?
It definitely does matter, and high alcohol is definitely the way to go. It's quick, it's effective, but it's not the only way to curb the coronavirus. And I think we have all been given a little bit of a high alcohol overload, and we are very confused as to what is good and what is not. It's often difficult when you get into a shopping center to suddenly have to scrutinize the bottle to see what they're spraying on your hands. So my sort of message to everybody out there would be to take hygiene into your own hands and to make sure that you are wearing your mask, you are washing your hands as often as humanly possible, and you are using a decent quality hand sanitizer.
You know, there was an incident where one noticed an elderly person entering a shop at a filling station, and they had their own sanitizer, and they refused to be sanitized at the entrance, and they wanted to use their own. So when dealing with such, how do you ensure that the alcohol content is the same? And does it really matter in as far as considering the percentage, and which percentage would one recommend?
Yes, it does matter. And the World Health Organization recommends a percentage over 70%. The alcohol content is one thing, but the quality of the sanitizer is another. So our advice is to always try and use a sanitizer that has been recognized by the SABC. So look for the SABC 490 mark on the container. And that is a very good indication as to whether it is a high quality sanitizer or not.
So when it comes to manufacturing sanitizers and supplying them in the market, we remember that there was a lot of talk regarding how sanitizers affect the hands and the skins of different individuals. Some people were complaining that when they use sanitizers a lot in a day, say you're going to 6 stores at the shopping mall, you have to sanitize yourself at least 7 times at the entrance in those 6 stores. And you end up having your hands being turned into yellow bone, hands.
Absolutely, absolutely. We don't recommend that you sanitize at every single store. Rather, sanitize as often as you can, but use a wipe. And a wipe is going to be a lot kinder to your skin, and it's going to remove as many microorganisms as possible on the surface of your skin. So the medical industry sanitizes about 20 minutes, every 20 minutes. We are often sanitizing more than that when we're popping into one store and into another store. And it's not good for your skin if you're going to expose it to that amount of alcohol. And we are going to see these outbreaks where you've got hands that are chafed. And we have no control over what the retailer are spraying onto our hands. So my advice would be, get your own sanitizer. And yes, be like the lady who refused to use the sanitizer at the front of the store. Make sure that it is a recognized brand.
Yeah, would that be a recipe for disaster, especially when you come across a security guard who's been put there and stationed there to say, sanitizer baba, or you are not going to enter?
I think we've been given a lot of information on high alcohol. But I go back to we need to wash our hands more regularly. We need to lessen that viral load on your hands. So it's not, yes, high alcohol is great, but I really think we are overusing the high alcohol at every single shopping center. And I understand why those regulations are in place. And I understand that every shop wants you to sanitize. But I do feel for the consumer because it really, really is a problem. And we have no knowledge of what we are being sanitized with. So I think that the security guards are actually getting quite nice. When I whip out my own sanitizer, they normally allow you through as long as they can see that you are using it.
You know, the president mentioned something very interesting about, this human behavior of somebody having a face mask, but putting it on their chin, like you're doing now. And they say they have their face mask. And the risk is still high when we do that. How do you think South Africans are behaving now? Are they becoming complacent? And with the second wave of this pandemic, are we likely to keep on increasing the numbers because of the slight mistake that we make?
Yes, I think we are becoming complacent. And we do have to, especially in public places, wear our masks and, wear them right over your nose, not just under your nose like a lot of people do. And the whole reason for wearing the mask is not necessarily to protect you, but to protect those around you. Because if you are walking around with corona and you don't know that you've got COVID-19, you are spreading that virus around the place. So that is the reason to wear the mask. So by not wearing your mask in public places, you are putting other people at risk. So yes, mask wearing at home, I can absolutely understand. You can let your guard down. You're living in the same home with all your family. It's not necessary to wear a mask. But directly you walk into a public space where you are sharing public spaces with people, that's where you absolutely have to wear your mask.
So do we have a risk of counterfeit sanitizers in the marketplace? And you remember the corruption concerning PPEs, and when it comes to face masks, do you think that there was manufacturing that was cutting the corners so that they can just pump up the numbers and get it out there at cheaper prices so that they can make more money?
Without a doubt, we're still seeing it. There are sanitizers out there being manufactured where we have no knowledge of what type of alcohol is being used. We have no knowledge of how they are mixing these sanitizers. We don't know whether the health and safety regulations are being followed. There is a lot of sanitizer manufacturers out there that are really still doing it to make a quick buck. And one of the reasons why we sent our products overseas for international testing is because we don't actually have virucidal tests available to us in South Africa. So that was one of the ways that we could say to our customers and the people that use our product that it really is a good product to use, because we've now got overseas international virucidal tests against the COVID-19. And unfortunately, there aren't any virucidal tests available in South Africa. So other than the SABC 490 and the SABC 1853, there's not enough legislation. And I also think a lot of our bodies are overworked at this point in time. So they don't have the time to police a lot of these sanitizer manufacturers that have just popped up between March and now.
So on a lighter note, I just wanted to ask you about the perception regarding people feel comfortable in their masks and the other notion of matching colors. For example, I'm wearing black today, but look at my mask. So do you think that it's a problem for people to say, I'm not going to put a face mask on because I'm going to look for a black one that matches my outfit? So having this one, it doesn't really look nice on air and in public. So I'd rather buy one when I arrive at the shopping center.
I think I've actually done that before myself, where I've gone out to a fairly smart function and I thought, oh my goodness gracious me, I have a red mask, I want a black one. So yes, I still think we are quite fashion conscious, and it's quite fun to see the masks that are out there. They're really fun ones available. But I think South Africans have got this incredible way of laughing at themselves, and it's so lovely to see people with funky masks. And I think we should all go out there and make sure that we maybe do chop and change our masks so we don't get bored of them. And that's the other thing that we stand the risk of doing, is not washing our masks often enough. So you kind of leave it in the car and you pop out, put your mask on, you pop back in the car, you take it off again, and you don't wash it often enough. We really, really need to wash our masks more often. So we should all have at least 2 or 3 masks.
Yeah.
And yes, let's make them match our outfits.
Yeah, I believe that in our wardrobes we have all matching colors for every suit and every dress. But thank you so much for speaking to us and making time to give us such insight into how we can take precautions on fighting the second wave of COVID-19.
Thank you for the opportunity. Appreciate it.
All right. Thank you so much. Here we're speaking to Annette Devenish, who is Marketing Director at Sanitouch, and of course giving us her views regarding the sanitizers and alcohol content thereof, and advising us to look for the SABC mark on the containers. And moving on